Ruth Dyson.
Speaker, my question is to the Minister of Health. Does he stand by all his statements on health services?
The Honourable Tony Ryle.
Mr. Speaker, yes. Mr. Speaker, yes, including the statement that the Labor Party doubled the health budget and got a lot less for it.
Supplementary.
The Honourable Ruth Dyson.
Why would 80-year-old Mr. Desmond Peat, an ex-Royal Navy serviceman who contracted polio after his war service, has had his left leg amputated, has a fused left wrist and is on the waiting list for a heart bypass operation, and has just had his 1.5 hours of home support cut, why would Mr. Peat give any credence to his statements on health?
The Honourable Tony Ryle.
Mr. Speaker, as I'd have to say to the member, if she was to bring that case to me, I would be prepared to look into it, as I have for her other colleagues.
The Honourable Ruth Dyson.
What has embarrassed him more? His colleague, Senior Citizens Minister John Carter, threatening grey power over their involvement in the Labour Green Aged Care inquiry, or his colleague Joe Goodhue, who refused to comment on the distress of Ruby Martin, an 86-year-old woman who cannot kneel, hang her washing out or lift anything heavy, and has just had her home support cut.
The Honourable Tony Ryle.
Mr. Speaker, I have never been embarrassed by those two colleagues ever, which is not something that those members opposite say about the person who just asked the question.
Nicky Wagner.
Supplementary.
Order. Order. Nicky Wagner.
Mr. Speaker.
Order. Nicky Wagner.
Thank you, Mr. Speaker. To the Minister of Health, what statements has the Minister seen about methods for assessing home support for the elderly?
The Honourable Tony Ryle.
Mr. Speaker, I have read Grey Power's recent lobby report, where they report that they met with Ruth Dyson. They reported that Mrs. Dyson said in relation to home care, quote, she is totally against assessing by telephone and has stated that the only way to assess a person is to visit them in their homes and to see firsthand how they are coping, unquote. Well, that's very interesting, because it was Ms. Dyson's government that formalised telephone assessments as a pilot in 2006 and further voted substantial public money to roll it out nationally in the 2008 budget.
The Honourable Ruth Dyson.
How does he reconcile his statements on putting clinicians at the centre of the health system with the list recently published by senior doctors of examples where there has been no clinical input at all into significant health decisions?
The Honourable Tony Ryle.
Mr. Speaker, what I am very well aware of is that clinicians throughout New Zealand are responding to the opportunities that this government is encouraging to give them a much greater say in the running of the public health service. And that's reflected all up and down the country, where many nurses in particular are taking responsibility for the way that they organise the awards and are finding themselves spending much more time caring for patients than they ever did under the mismanagement of that previous government.
The Honourable Ruth Dyson.
How does he reconcile his statement about integrated family health centres, and I quote, there were already those services available in Auckland, when these centres have been heralded by him as new and innovative? Why is he demanding the establishment of centres to open when, in his own words, these centres already exist?
The Honourable Tony Ryle.
Well, Mr. Speaker, I think when we look at the word embarrassment and the question that was just answered, I think members would find it quite difficult to understand the actual question from the member. What I interpret her as saying is that the need to consolidate general practice and provide services for New Zealand is something that the government supports, and we're going to be seeing a lot more of it over the next couple of years.
Point of order, the Honourable Ruth Dyson.
Mr. Speaker, despite your earlier request that members not seek leave to table information from a newspaper article, the Minister, when I referred to the plight of Mr. Desmond Peat, implied that he had no knowledge of it, and therefore, on that basis only, I am seeking leave to table the letter from Mr. Peat published 2 weeks ago in the Otago Daily Times outlining the situation he is in.
Order. I don't think Otago is a back block of New Zealand. We won't be seeking leave for that. Question. Point of order, the Honourable Ruth Dyson.
I seek leave to table the speech given by Mr Ian Powell to the Australian Medical Association called Challenging Times, Uncertain Directions, outlining his concerns and that of senior doctors at the lack of clinical input into significant
Order. Leave
health
is sought to
decisions.
table that document. Is there any objection? There is objection. Question number 6, John Boscawen.
Thank you, Mr Speaker.